99.5 FM, WGRV, Greenville, Tennessee. Ron Metcalfe joined by Governor Bill Lee on the phone this morning. Good morning and Merry Christmas, Governor.
How you doing, Ron? Merry Christmas to you too, sir.
Doing well. Thank you. Appreciate you calling in this morning. We know you have just a few minutes, so we'll get right off at it. Talk to us about what Tennesseans need to do coming up for Christmas. If we look at Greene County statistics, we've had over 2,000 cases since Thanksgiving out of a total of 5,000. So we're 40% of our cases have come in the last 3 to 4 weeks. What do people need to be doing to get the coronavirus in check and get us through the winter till the vaccines can be distributed?
Yeah, I think the first thing people need to remember is, or at least know, is really where we are. You just quoted a statistic about Greene County. Part of my effort Sunday night to inform people was not to say, here's what you have to do, but here's what we need to do. We are in an enormous surge. We have the worst cases of any state in the country right now. So our case count per capita is higher than any other state. We have a hospital capacity problem, and what that means to everyday people is whether you have COVID or not, if somebody in your family has a heart attack or a car wreck or a stroke, it's going to be a strain to get them care in a hospital that's filled with COVID patients. And we're not there yet, but we're headed that direction if we don't do something to blunt the surge. And that's why I appeal to Tennesseans, hey, y'all, you're busy, you're working, you got your families, we got Christmas coming, and that's all exactly right, and that's as it should be. But I have an obligation to say, hey, you don't watch the data every day. Look at this, recognize exactly where we are, and let's all come together and do this. And there's a couple of things people can do. We saw what happened at Thanksgiving, exactly what you said in Greene County. Gatherings around Thanksgiving when we weren't really sure about how much impact that was going to have, it's created an enormous surge here in Tennessee. Let's don't do that again at Christmas. Figure out how you can be safer. Figure out how you can gather without members of your household. Wear a mask whenever you can and when you're around people that aren't in your household. And for a couple of weeks here, we got to kind of all come together, blunt the rise of the cases in the short term. We got vaccines coming, almost 100,000 a week, and we're going to start to get big swaths of the population vaccinated over the next weeks and months. But just for the next few weeks, we got to blunt this surge.
How is the vaccine distribution going so far? I know Greene County got their first vaccines that were able to be distributed this week. How is it going across the state, and how quickly do you expect that to ramp up?
Yeah, we're pretty encouraged with the way the vaccines are going. It's a very complicated process, but our health team created a really great plan. In fact, the CDC, Dr. Redfield from the CDC said Tennessee's distribution plan was the best in the country. We're very encouraged by our plan, but now we got to execute. And there's vaccine in every county. We are seeing shipments come in every week. They're coming in as promised. We don't know the numbers yet that will come in, but we're very certain that this is going to have an impact, and we're going to be able to get to it pretty quickly. We've already vaccinated. As of yesterday, we had vaccinated about 50,000 people. I think that's correct. I'd have to confirm it. But our anticipation is that by New Year's, 200,000 Tennesseans will have received their first dose, and that's a really good thing. And particularly because a large number of those people will be nursing home residents because they're one of the top priorities. They obviously are the most vulnerable of our neighbors. And we're working to protect them and healthcare workers so we can have that precious hospital capacity for everyone in Tennessee when they get sick for any reason.
As we get past that first stage where the first responders and those that are the highest priority get it, what would you say to the actually pretty significant portion of the population that says they're not interested in getting a vaccine?
Yeah, well, It's absolutely a choice of Tennesseans. We're not mandating vaccines. People have a reason to evaluate whether or not they want to take it, and I've been real clear about that. Our obligation, same with what I said the other night about the virus, our obligation is to give you as much information as you can, and then give you access and the opportunity to make that choice if you want to. I think trusted voices are really important. Tennesseans should talk to their doctor. I think most people trust their own doctor. They might not trust the health system or the public health. I don't know who people trust. Everyone has to determine where's their most trusted voice. But most people trust their doctor to give them medical advice. I'd say that's where people should turn. But we're not telling people they got to take it. We're just going to make it available to people. So if they want to take it and become immune to this virus, they have access to it.
Well, I voted for, and I trust Governor Bill Lee. Will you be getting that vaccine, Governor?
Yes, sir, I will be. I will be. And I have an 87-year-old mom, and I told her the other day, she has the choice in that, and I said, Mom, I think you should take it. And when the time is right for her, there are risks for folks, and you got to weigh the risks. And yes, I'm going to take it. I do know an awful lot about how it was developed and the safety of this vaccine. And we hope that enough people take it that it really impacts the spread of the virus in our state, so we can keep schools open, we can keep businesses open, we can keep our lives moving forward. And that's been really important to me. It's the reason we haven't shut down this state in the 89 counties that the state controls the health department. We haven't shut it down. We haven't made people stay home. We haven't closed or restricted businesses, because livelihoods are incredibly important. People's living, their jobs, their lives, and we got to protect those while we protect the health of people. So yes, I hope people get the vaccine, because I think it'll keep businesses and schools open. But again, it'll be a choice every Tennessean can make on their own.
We've just got about a minute left, Governor, so I ask you a two-part question. First, how is the First Lady doing, and if she had a positive test? And then second, I'll let you just give a Christmas wish to the people of Greene County.
Yeah, First Lady's doing great. Thank you for asking. So many people prayed for her when she got sick, and she is fully recovered. If not fully, she's 95% there. I talked to her this morning, so she's doing really well. Thank you for that. And I remain asymptomatic, so I don't think I contracted the virus, and that's a good thing. Hey, it's Christmas week. It's, the birth of Christ occurred in the midst of a very chaotic world, and it's kind of the truth of it, right? That event, which provided peace beyond understanding for those who follow him forever, that event transcended the circumstances of his day, and it was the most hopeful, eternal event for all mankind forever. That we're in a tumultuous moment in time, and there's trouble around. People have lost family members. There's a pandemic. People have lost jobs. There's trouble. It's a bit of a challenging world we're living in right now, but it does not erase, and the hope of this season transcends all of the circumstances in life. I've been through some pretty good tragic events in my life, and hope is a powerful force. And so my hope this week, as the Tennesseans will step back and be reminded that there is hope, and that hope and that peace and that joy in the midst of whatever's going on around us is available to us. And I hope that's the case for Tennesseans, which will, in fact, create a Merry Christmas.
Governor, we thank you for your time and wish you and the First Lady, I hope she gets over it very well and that you all get back together soon, and wish you a very Merry Christmas. We appreciate you calling in this morning.
Thank you, Ron. Talk to you soon. Merry Christmas.
Bye, Governor. Governor Bill Lee joining us this morning here on WGRV.